Welcome back to my YouTube video channel. Today I will go over the step-by-step uncover the cover screw of the implant of tube number 10 in this video right here in this picture. Patient have braces done, the tube missing, or surgeon placed the implant in. Patient moved from different state in here.
Implant
So
placed for about 5 months ago. There's some bone
what
so we're going to uncover this
surgeon
area
placed in.
here.
This is the biohorizon implant inside the patient mouth right now. I'm numbing the patient, and after I place the hyaline abutment of the biohorizon, the bulkiness of the gum is sticking out like this. As you can see how I make the incision more toward the lingual, so I can pull out the bulkiness of the carotenoid suture, which is helpful for recreating the gingival papilla. So I'm going to split the this part right here half, and one on just stay where it is. The other one is I'm going to move to the meso because I feel like the meso part has some defect gum, and it needs some extra thickness of the gum. So I'm pushing it over this side, and I'm going to suture it down. So yep, just a split in thickness technique. We did some release. Now I'm just trying to mold it over, push it over, and we'll just go ahead and suture this up after we do this. It's a little tricky, but the previous surgeon, he gave a very thick gum tissue right on top. I don't know how he did start up the procedure, but he ended up with a nice thick carotenoid tissue, which is helpful for the restoration at the end. So as you can see on the meso part, I don't like it. Probably when he does the surgery, he flap it out, and therefore there is a defect of the gum toward the distal of number 9, and that's why I'm trying to move that bulky of the gum toward distal of number 9 to recreate the interdental papilla. It's really tricky. I try to do my best. So this is a resolvable suture. I'm hoping about 5-6 weeks it should be disappear by the time the patient coming back. I'll be scheduled a patient about a couple of week checkup, and then follow up is 6 weeks, let it heal. So that's the suture. After that, as you noted, there is a little opening on the distal facial aspect of number 9. That was when I do the surgery, I discovered that there were the defect of the surgeon when he placed it. When he does the surgery, he create that part there is very weak. Also, patient is continue with the Invisalign retainer, so there is some kind of modification of the bone and the gum on that particular number 9. Not so happy. If this is my case, I would make sure that to number 8 and 9 is straight and perfect first, but patient is in the process of finishing up the Invisalign case, which trying to correct number 8 and 9 evenly. So again, just want to show you, this is a quick suture, expose hyaline cover screw, and then placing the hyaline abutment. I gave her a temporary crown,
Hollywood
which
dentist.
previous clear aligner dentist didn't put it on there. Anyway, this is a 6-week hyaline. The hyaline abutment look right at the gum level, and the tissue look nice, hyaline well. Orientation wonderful, as you can see, just right at where the smile lies. So that's a good surgeon placement technique. I'm pretty satisfied so far with the gum healing, although you can see on the distal aspect of the distal number 9 still need to be time for heal. Put the scan body, and I'm going to do digital scanning of this particular scanning of the horizon. I like the body scanner because it's nice. You just use a hand to tie it in, and you don't have to use the screw.
That's incredible. Look at that.
So we are scanning, and we are going to just scan this one. We will click
So did we ever scan the whole arch?
give some instruction to the lab sending out to the lab will continue evaluate and fabricate the digital crown and show me. And then once they show it to me, if I need to adjust anything, then I tell the lab, everything communicate digitally, and the patient will receive the best crown. If anything I need to tell the lab will hold on to before they fabricate. They're going to let me take a picture of the implant scanner, body scanner of the x-ray, and also they want me to take picture of the shape that I pick for the patient. It kind of worked out very well. Really like the trio digital, trio digital scanner right now. The trio number 3 seems to be work out well. But those of you watching this, if you have any comment or question about whether the scanner
I'm doing the
digital scanning
Horizon
or anything
scan
like that,
body, and what I like about this one is
surgical approach,
I don't need a tool. I just need my finger to
I
remove
didn't
the
start
sound.
this implant.
So
Someone
it's very
else did that.
convenient.
I just
Shout out
restore
to
it, but I have to make sure that
guys. I like it actually.
maximize
Make
the
my life
result of the
simple.
case. So
Want to just show
right,
you the
and
scan
you can
body
see
real
that in
quick.
the future there might be the interproximal dental papilla need to be rebuilt. But this is the best what I can get. So you can see that very, very deep implant placing and very nice thick
I guess you did your job
we're
with
trying to
flossing
build
and
back.
all of that.
Tightening the heel and abutment back.
Right. Good.
Take some photo, just show you, that's it, right at where her smile. I also mentioned to her that the space number 10 seemed to be very big. I'm hoping that if once they match the color, we can give the patient a nice crown. But if it's too big, we're going to trim it back. Thank you for watching. Have a great day. Bye-bye.